Retinoblastoma is a rare but serious form of eye cancer that primarily affects young children, usually under the age of 5. It originates in the retina, the light-sensitive layer of tissue at the back of the eye responsible for vision. The disease can occur in one or both eyes, unilateral or bilateral, and is often associated with genetic mutations, particularly in the RB1 gene, which normally regulates cell growth. Early detection is critical because untreated retinoblastoma can spread to other parts of the body, including the brain and bones, and can be life-threatening. Causes and genetics. The main cause of retinoblastoma is a mutation in the RB1 tumor suppressor gene, which is responsible for controlling cell division and preventing abnormal growth. When this gene is defective, retinal cells multiply uncontrollably, forming a tumor. Hereditary retinoblastoma, about 40% of cases are inherited. Children inherit a defective RB1 gene from a parent, which increases the likelihood of developing tumors in one or both eyes. This form often presents in both eyes. Sporadic retinoblastoma, the remaining cases occur due to spontaneous mutations in the RB1 gene and usually affect only one eye. Environmental factors play a minimal role, as the disease is largely driven by genetics. However, understanding the inheritance pattern is important for family counseling and early screening of siblings. Symptoms and signs. Retinoblastoma often presents with distinct visual symptoms that parents or caregivers may notice. Common signs include leukocoria, a white reflection in the pupil, often noticed in photographs taken with a flash. This is the most characteristic sign of retinoblastoma. Strabismus, misalignment of the eyes or crossed eyes may occur due to the tumor affecting vision. Redness or swelling, the eye may appear red, swollen, or irritated without obvious infection. Poor vision, the child may show signs of vision impairment or lack of focus. Pain, in advanced cases, eye pain or enlargement may occur. Early recognition of these signs is crucial, as prompt medical intervention can prevent the spread of cancer and preserve vision. Diagnosis. Diagnosis of retinoblastoma requires comprehensive eye examinations by a specialist in pediatric ophthalmology or oncology. Key diagnostic tools include ophthalmoscopy, direct visualization of the retina to identify tumors. Ultrasound, helps to assess the size and extent of the tumor. CT or MRI scans, evaluate tumor spread to the optic nerve or brain. Genetic testing, identifies RB1 mutations, aiding in familial counseling and screening of siblings. Early diagnosis not only increases the chances of saving the child's life but can also improve outcomes in preserving vision. Treatment options. Treatment depends on the size, location, and spread of the tumor, as well as whether one or both eyes are affected. Modern therapies aim to save life, preserve vision, and prevent recurrence. Common treatments include chemotherapy, systemic or localized drugs shrink tumors before additional therapy. Laser therapy or cryotherapy, targets small tumors with minimal damage to surrounding tissue. Radiation therapy, used in cases where other treatments are insufficient. Enucleation, surgical removal of the eye is sometimes necessary if the tumor is large or vision cannot be saved. Intra-arterial chemotherapy, directly delivers drugs to the eye through the ophthalmic artery, minimizing systemic effects. A multidisciplinary team involving oncologists, ophthalmologists, and genetic counselors ensures personalized care for each patient. Prognosis and survival. The prognosis of retinoblastoma has improved significantly with early detection and modern treatment. In developed countries, the survival rate exceeds 95%, although vision outcomes depend on the extent of disease at diagnosis. Bilateral cases require careful monitoring, as children are at risk for multiple tumors over time. Long-term follow-up is essential due to the risk of secondary cancers in hereditary cases, particularly if the child received radiation therapy. Prevention and screening. While retinoblastoma cannot be fully prevented due to its genetic basis, early detection and family screening are highly effective. Children with a family history of retinoblastoma should undergo regular eye examinations shortly after birth. Genetic counseling can help parents understand the risk for future children and facilitate timely monitoring. Conclusion: retinoblastoma is a rare but highly treatable childhood eye cancer when detected early. Its strong genetic basis makes awareness, screening, and early intervention vital. Advances in treatment have not only improved survival but also focused on preserving vision and quality of life. Parents, caregivers, and pediatricians must recognize the early warning signs, particularly leukocoria, to ensure timely diagnosis and effective management.